So this is a very important question, and this is what we have observed, that cancer rates are definitely increasing. They are on the rise, and there are multiple reasons for their increase in developing countries, including India. Now, one of the important reasons is that as more and more westernization is happening, our lifestyles are changing. So, if we see in the main big cities, Delhi, Mumbai, Bangalore, Calcutta, the incidence of breast cancer, especially which is related to lifestyles, is definitely going up as compared to cervical cancer. So, as you know, cervical cancers and breast cancers are the leading cancer in women in India. And we have found that the rate of breast cancers are going up because of lifestyle changes, because of urbanization. Across the length and breadth of our country, if you see across the geography, there are some areas, for example, Northeast, very high incidence of nasopharyngeal and head and neck cancers. Towards the south, we see an increase in thyroid cancers, in Delhi, breast, gallbladder cancers. Multiple reasons, lifestyle, smoking, alcohol, all contribute to this. And I think it's our solemn duty to take this as a challenge and educate and make aware our population to control this menace at the earliest. I can say with certainty that prognosis of cancer patients across the world, and India is no exception, is definitely improving. Over the past few years, we have seen, with increasing use of better and better technologies, increasing early detection of cancer patients, early cancer patients, we are able to improve the outcomes of cancer patients. And these technologies are improving in radiation oncology, in medical oncology, in surgical oncology, and they have definitely made this twofold difference. One, improving outcomes, improving control rates, improving survival. Second, decreasing side effects, decreasing the adverse effects of therapy, and consequently improving the quality of life and quality of life years.
So thank you for asking. So Pseudomyxoma Peritonei is a rare cancer which affects the peritoneum. So before discussing about the cancer per se, I'd like to discuss about what is peritoneum. So peritoneum is a thin, flimsy layer which covers the abdominal organs, intra-abdominal organs, and also the abdominal wall. And the cancer affecting it is called a peritoneal cancer. So Pseudomyxoma Peritonei is a peritoneal cancer which affects the peritoneum. So it largely arises from the appendix, and the peculiar thing about this cancer is that it produces a lot of mucin. It produces a lot of jelly. So mucin is a jelly which forms inside the abdomen, and it fills the entire abdomen. So now it becomes a difficult to treat disease because nothing works. No chemotherapy works, and also no radiation therapy works. So this is the reason we need to know about this rare disease, which technically speaking is a stage 4 cancer, but potentially curable. So the symptoms of Pseudomyxoma Peritonei is very vague. The patient generally have bloating sensation, indigestion, distension of the abdomen. The abdomen becomes big. So you have to understand that these cancer cells, they produce a lot of mucin, they produce a lot of jelly which fill the abdomen, and because of this a large amount of mucin, the abdomen becomes big, and this also compresses the intestine and the stomach. So the patient loses interest in eating, there is loss of appetite, which results in also loss of weight. So the symptoms are not very classical, very clear cut. That is the reason you should be aware of the symptoms. You should listen to your body, and if any symptom which is abnormal and persistent, that is the time you should consult your doctor, you should consult your oncologist, so that you are diagnosed correctly and treated correctly. Because in cancer, everything depends on correct diagnosis and correct treatment. So if we talk about Pseudomyxoma peritonei, these patients are stage 4 patients. So in stage 4 patient, now cure is possible. So if we talk about a decade ago, these cancers were incurable. But with development in medical science, now we have a technology, we have a surgery, we have a surgical cure for these patients. So there is a surgery which is called cytoreductive surgery, popularly called CRS and HIPEC. So this is a two-stage surgery. So first step is a good surgery where all the disease which is visible to the eyes, all the macroscopic disease is removed surgically. The second step is HIPEC, where heated chemotherapy is instilled into the abdomen directly, which takes care of the microscopic disease, which results in good control and cure. So now from a stage 4 incurable disease, we have moved towards a potentially curable disease. If I talk about the outcomes are really good. So in cancer, we always talk in terms of survival. So the 3-year survival for these kind of patients is in the range of 70 to 80%. Majority of the patients are cured of the cancer and they are cancer winner.
So radiation therapy is a very, very important cornerstone of cancer management. Radiation therapy can be used for multiple reasons in cancer patients, including curing and including palliation of the disease, which again is a very important endpoint. Now, radiation therapy, there are different technologies available as of now, including 3D CRT, IMRT, IGRT, stereotactic radiosurgery, stereotactic body radiotherapy, 4D treatments. And all these treatments have just one aim: to increase the accuracy by which we hit the tumor and decrease the dose to the adjacent organs and tissues, thereby reduction in the side effects. Now, nearly 60 to 70%, please note, of all cancer patients would require radiation treatment at one time point or the other during or after their diagnosis. And that is why I again say that radiation therapy is a very important tool besides surgery and chemotherapy and other targeted therapies. It's a very important, and many a times it's a very cost-effective tool as well, and it has augured the goal of improving life and improving quality of life of cancer patients.